Hello and welcome to my fireside chats. This particular series is on the ethical violations in forensic psychology, and this particular video segment is going to be on Standard 2.01, Boundaries of Competence. Now, this particular ethical standard of the APA Ethics Code, um, all forensic psychologists, all mental health people working in the family courts are in violation of this standard. Now, the ethics standards across different professions, each profession has their own ethical standard. Using the APA ethics standard from the American Psychological Association because I'm a psychologist and it's the one that governs me, but it is also the most well articulated. It has the most features to it and describes the most things. And so it represents what, in my opinion, is the highest quality of professional ethical standards would be the APA Ethics Code. I've looked at some international standards. There's some that come close, but I still think the APA Ethics Code is is the best one out there. So that's why I'm relying on that one. Plus, I'm a psychologist, so I stay with what I know. So standard 2.01, doctors are not allowed to be incompetent. And so that's a problem over here. The pathology is a shared persecutory delusion. And I'd cite to Walters and Friedlander, who cite to me, that in the journal Family Court Review, they're aware that it's a potentially a persecutory delusion. And so that requires all of them to be competent in the assessment of delusional thought disorders and to conduct a proper risk assessment for possible child abuse when it's warranted. And the only cause of severe attachment pathology is child abuse by one parent or the other. So this is going to be a child abuse diagnosis one way or another when a child's rejecting a parent. So they should be doing a risk assessment every single time. But they're not competent to do a risk assessment of child psychological abuse. They're not competent in the assessment of delusional thought disorders. They're not competent in the assessment of attachment pathology. A child rejecting a parent is an attachment pathology. None of them have background, training, education, or experience with the diagnostic assessment of delusional thought disorders or with the diagnostic assessment or treatment of attachment pathology. And yet they're working with delusional thought disorders and attachment pathology directly in violation of 2.01. So let me read this for a second. Psychologists provide services, teach, and conduct research with population and in areas only within the boundaries of their competence, based on their education, training, supervised experience, consultation, study, or professional experience. So that's what I am for these professionals because I am competent in the assessment of delusional thought disorders. I am competent in the in attachment pathology and working with attachment pathology. So if they want, I'm the scaffolding from their current state of incompetence to the place they need to be of competence. And so they should be seeking consultation. It's not my responsibility to educate them. I should not have to educate a mental health professional in order to have a professional level conversation with them. They should already know. If I have to teach them about family systems, or if I have to teach them about delusional thoughts, if I have to teach them about anything, they are in violation of 2.01 boundaries of competence. I am not the ceiling, I am the floor. I'm basic competence. If you don't know as much as Dr. Childress, why not? Are you just lazy? Must be because I know it. Okay. Or do you think that knowledge isn't necessary for what you do? And I've seen what you do, and yeah, you're right. Knowledge is not necessary for what you do. What actual psychologists do, though, however, requires professional knowledge, requires mandatory. So I can tell you right now, every single forensic psychologist in the family courts is in violation of 2.01 boundaries of competence. Delusional thought disorders, attachment pathology, I can give you a couple more, child abuse, trauma, none of them have. And we're going to look at their vitas. That's where you will see a violation of 2.01 is by a review of their vita. 2.04, you actually can look at their reports and extract a violation 2.04 from the report. 2.01 you'll see on their vita. Now notice the domains. They bound you based on their education, training and supervised experience or professional experience. Education, training, and experience. So look on their Vita to where on their Vita does it demonstrate their education, training, and professional experience in the diagnostic assessment of delusional thought disorders. There's your cross-examination question. Tell me, doctor, where on your Vita does it show that? Where on your Vita does it show your education, training, and experience in the assessment and treatment of attachment pathology? Where on your Vita have you worked with child abuse and complex trauma? Where on your Vita does it show the training and education in family systems therapy? So I would, if I'm an attorney, I could look at 4. I would focus on the 2. I would focus on delusional thought disorders and attachment pathology. Get them to clearly state that it's not on their Vita. And so now they're in violation of competence. I'll address this more when I talk to the attorneys, but if I'm doing a cross-examination in my fantasy world as an attorney, I would first ask them a series of questions. I would ask them, are the ethical standards of the APA optional or mandatory? They're mandatory. Okay. Do you standard 2.01, boundaries of competence? Do you agree with standard 2.01? Yes, I do. Do you abide by standard 2.01? Yes, I do. Get them to get their neck out there. Then you ask them, so where on your Vita does it demonstrate your education, training, and experience with the diagnostic assessment of delusional thought disorders? And then you hit them up with Walters and Friedlander quote if they try to escape it and say, it's possible, so shouldn't you be competent? And they'll get all twisty on this one, and then that'll wrap them up as you get to the ones deeper into the situation. So this one is at the foundational level. However, this is a Vita one. The one that's most vulnerable is going to be 2.04, which we'll talk about in the next section. But I want to notice that they are able to get up to competence if they consult with somebody who is. Okay, so that's an avenue open to them, but nobody's taking it because they are lazy. They are incompetent, unethical, and ignorant is sin and is lazy. No parent should ever have to explain to the doctor what the pathology is and how to diagnose it and treat it. The patient should not be explaining the pathology to the doctor. The doctor should be explaining the pathology to the patient. So if you're having to explain the pathology to the doctor, that's a violation of this ethical standard 2.04, mandatory ethical standard. So let's take a look at some subsections of this, because this is 2.01a. Drop down to 2.01c. This has to do with, this would be related to their delusional thought disorders, because the assessment of delusional thought disorders is a mental status exam of thought and perception. You look at the Martin quote, it's hard to do. It takes training to be able to conduct a mental status exam of thought and perception. If they don't have that education, training, and experience, they're not competent in the assessment of delusional thought disorders. They're not competent in the mental status exam of thought and perception. So that would be the area, delusional thought disorders. The techniques would be the mental status exam of thought and perception. And then you just shift categories, and the area would be attachment. And they're not trained, and they don't, they're not competent in the attachment pathology would be a new area for them. But again, look what they can do. They can undertake the relevant education, training, supervised, or consultation. So if it's not on their Vita, they can make it up, but they have to get in terms of somebody who is competent with the pathology. And then the D would actually be the one that would actually probably cover most of the forensic people if they wanted to remain in the family courts and begin to adjust to a more clinically oriented practice. That when psychologists are asked to provide services to individuals for whom appropriate mental health services are not available and for which psychologists have not obtained the competence necessary. That's what you find in the family courts. No clinical psychologists work in the family courts, so you will not find the competence in delusional thought disorders or in attachment pathology in the family courts. It's not there. Early childhood is where you'll find the attachment pathology. Schizophrenia is where you'll find the delusional thought disorder expertise. But no clinical psychologists work in the family courts because it's too professionally dangerous. It's too professionally dangerous for Dr. Childress. I'm telling everybody to be ethical, and the licensing boards or the forensic psychologists on the licensing board sanction me. And so if it's too dangerous for me to be here, it's too dangerous for any clinical psychologist to be here. So my recommendation to all clinical psychologists, don't work in the family courts until it becomes safe, because there's no reason we should have to put our license on the line. Absolutely zero. And so, but I did. I took the hit to expose the corruption of the licensing board by the forensic psychologists. The licensing boards are not corrupt on the clinical side, but they are corrupted by the influence of the forensic psychologists on the boards. And I'll cite to the New York Blue Ribbon Commission on Forensic Custody Evaluations. They have no scientific value. They're harmful to children. They're violation of multiple ethical standards, and the licensing boards have done nothing to enforce ethical standards of practice within forensic psychology. They don't even put on trainings for them. They don't even bring it up as an issue for them. And so that's a huge problem. The APA does nothing. The AFCC does nothing. And that 1.04 and 1.05 apply to all psychologists. There's problems. So if there's no services, and which is currently the case, but they're going to provide services anyway, because otherwise there's no services and the people are being denied and the court's being denied input, then psychologists with closely related prior training or experience may provide such services in order to ensure that services are not denied if they make a reasonable effort to obtain the competence required by using relevant research, attachment pathology, delusional thought disorders. You can look my ABA reference list: personality disorders, dark personalities, complex trauma, child abuse. Reasonable effort to obtain the competence required by using relevant research, training, consultation, or study. So again, do you agree with the ethical standard? As part of that whole opening thing of, would you please read the standard 2.01? Do you agree with standard 2.01? Do you abide by standard 2.01? You might want to ask them, why is standard 2.01 important? Why is it important that psychologists practice only within the boundaries of their competence? What would happen if psychologists practice outside the boundaries of their competence? Ask them that before you get into the actual questions and looking at their vita. Ask them to explain to you why this is an important standard, required, mandatory standard in professional psychology. So with that, let me close off standard 2.01, boundaries of competence. This is the core issue. This is their ignorance. None of them know what they need to know. And anybody who says Dr. Childress is coming up with some sort of new theory is exposing that they are not competent under 2.01, because no, I'm not. I based everything I say on the established knowledge of professional psychology for specifically this reason, to hold them accountable for domains of knowledge that they are required to know for competence. So with that, let's switch over to another competence standard, 2.04.